Hi everyone, my name is Emily Chingbo and the topic for today is modeling Zika virus infection in pregnancy. Definition: Zika virus crosses the placenta and causes congenital disease. Infection in pregnant women has emerged as a major global concern because of its link to congenital abnormalities, including microcephaly, spontaneous abortion, and intrauterine growth restriction. In addition, Zika virus infection in other age groups has been associated with severe neurological disease and the Guillain-Barré syndrome. Transmission: Transmission cycles between human and Aedes aegypti mosquitoes in urban settings can cause large-scale epidemics of Zika virus infection. Although mosquitoes clearly are the primary cause of Zika outbreaks, other modes, such as sexual transmission, have been reported. So far, all cases of sexual transmission of Zika virus have been from infected men to their parents. Viral persistence in the testes and semen has been described, and the window of sexual transmission remains uncertain, which has increased the apprehension about Zika virus infection during pregnancy. Here's a video.
Most pregnant women, when they become infected with Zika virus, have no symptoms. About 4 out of every 5 women that are infected will never know they're infected. 1 in 5 may develop some fever, a rash, red eyes, joint pain. The problem what we've discovered in pregnant women is that the virus can actually cross the placenta and infect their baby. So the babies, depending on when the woman gets infected, may end up developing microcephaly, which is a very small head, and the brain development may actually be very abnormal. It does. Like a lot of viruses that end up affecting pregnant women, the earlier on in pregnancy that they become infected, the more likely they are to have obvious abnormalities in the fetus, because that's the time where the fetus is doing most of its development. We do believe pregnant women are at risk throughout the pregnancy. We know that infections that have crossed the placenta and actually affected the babies can occur at any time during pregnancy. It just depends on when in pregnancy they're infected as to what the effects are that we're going to see. Right now, we know that Zika virus will cross the placenta and may affect a baby. The problem is we have so limited data that we don't know how many.
Epidemiology of the virus. The question in utero transmission attained prominence as the emergence of Zika in Brazil and other parts of Latin America became associated with an increase in the number of cases of microcephaly. Moreover, a prospective study including Zika-infected pregnant women in Brazil showed that 20% of the fetuses has gestational abnormalities, including microcephaly and intrauterine growth restriction, which as a group of cases result in fetal death. Apart from this evidence, the development of an uterine animal model of Zika virus transmission and infection was considered to be more important in order to establish causality, satisfy the criteria for proof of teratogenicity, and provide a means for screening candidate vaccines and therapeutic agents. The risk factors: viral antigen localizes in trophoblasts and endothelial cells in the placenta, and endothelial microglia and neural progenitor cells in the fetal brain. Zika infection of the placenta increases production of IFN and expression of IFN-stimulated genes 48 hours after infection. An infected mother is a risk factor for transmission of Zika virus to an unborn child, vertical transmission. Getting blood transfusion and sharing needles for intravenous drug use in an area of local Zika virus transmission, or perhaps with a woman carrying an infected fetus, are further potential risk factors. Here's another video.
What do I need to know about Zika? That's the most question many doctors say they're currently being asked. In the wake of warnings over the spread of Zika and its devastating effects on fetuses, here's what you need to know about the virus. How do you get Zika? You may be exposed to Zika if you travel to an area where the virus.
So, in conclusion, infection during pregnancy with contemporary Zika strains causes placental infection and injury, and the Zika virus spreads to the fetal brain and kills neuronal progenitor cells, which probably contributes to the microcephaly and other congenital malformations that have been observed in human neonates. The new mouse models provide a foundation for defining mechanisms of pathogenesis and represent a resource for determining the effects of Zika virus strain variation on clinical manifestations and for testing a candidate therapeutic agents and vaccine. Thank you.